One example, which was done by myself in a study in Sri Lanka on wheat flour fortification as a remedy for the iron deficiency, anemia, and folic acid deficiency. We did this study about a year back. There, we tried to look at this issue from economics point of view. To assess economic losses due to iron deficiency anemia and folic acid deficiency in Sri Lanka. What are these economic losses? Perinatal mortality due to mother's anemia. Losses in anemic adult workers due to IDA. Future productive losses of children due to anemia. Mortality and disability from birth defects due to folic acid deficiency. So with this background, we tried to estimate benefits gained through introducing a wheat flour fortification program to avoid IDA and FAD. So we made some projections for the next 10 years. For instance, estimating the cost of national fortification program for the next 10 years, then estimated benefits of the national fortification program for the next 10 years, then cost-benefit ratio for the next 10 years, and unit cost per person per year. So the results are very interesting. What we have found was that for wheat flour fortification, you have to spend only 740 rupees per person per year, which will lead to reduction in burden of disease and economic loss in with accounts for more than US $90 million over 10 years. So cost-benefit ratio is very high. That means if you spend $1 for flour fortification, at the end you will be getting an earn or save $7.2 in the future. So in addition to that, there were some other benefits. For instance, the prevention of infant deaths. That was $9,000, around 9,000, but there's no possibility of making an estimate for that, valuing for that. So with this background, I would like to say there's a very close relationship between health and economic development. But health is not only, as Professor Carlos Fonseca said, it's not only absence of illness, it encompasses social well-being, spiritual and mental well-being as well. And economic development narrowly people measure as a increase in the goods and services produced during a given period, normally 1 year. It's a very narrow definition. So you can see here the relationship between health and economic development. For instance, I look at the malnutrition. Malnutrition leads to poor health leads to low productivity, and low productivity leads to, again, increasing poverty. So this kind of vicious circle is there. Somehow we have to break it through, not only through economic development, through other means as well. That's my theme of the. So today, if you look at economic effects health on economic development, there are two types of effects. One is direct effects, other one is indirect effects. Direct effect is effect on labor productivity. Labor productivity due to, and one example is, as once again, malnutrition will lead to, reduction of malnutrition would lead to increased productivity and also production. Indirect effects due to better health, reduce infant mortality, reduce maternal mortality, more emphasis on education and better social life, and reduce providers' cost as well as direct and indirect household cost of illness. Those reduction of cost can be used for some other purposes. All will directly, indirectly affect economic development positively. But in the long run, increase in life expectancy may lead to increase the burden of looking after elderly population. So there are negative effects as well. So in the Sri Lankan context, we look at health services, we have public sector as well as the private sector. Public sector is well established, but there are some drawbacks. Drug shortages, lack of facilities for investigations, poor responsiveness of especially public health workers, and emergence of it's a very important cost-sharing mechanism. That means part of the cost of service is borne by the patients for drugs, investigations, etc. So in the private sector, I would like to say it's less developed and less organized, because it's focused largely on the urban sector and the affordable people. And there is no regulatory mechanism actively implemented by the state. So with this background, if you look at how much we spend for healthcare services, you can see the government spends, if you count it as percentage of GDP, it's about 1.5% from the gross domestic product is the share of the public health sector. And on the other hand, there's a contribution of service receivers that also counts somewhere around 1.5% of the GDP. Altogether, it's about 3%. But compared to a developed country, this is much more less than those percentages. For instance, in USA, it's somewhere around 14%. Here we spend only about 3%. And on the other hand, we have made some calculations. Our government spends only 10 rupees per person for the provision of healthcare services. That means per capita health expenditure per day. It's a very small amount, 10 rupees per day per person, but we have achieved a lot. So, with these resource constraints, we are now facing up with some other challenges as well. I have listed out 5 challenges. One is the emergence of the non-communicable diseases. It's a challenge how to handle non-communicable diseases in a cost-effective manner. How to deal with the demographic transition in an effective and efficient manner. What measures have to be taken to deal with epidemiological transition in an effective and efficient manner. How to deal with the advancement of technology in the health sector. How about the emergence of a new demand pattern amongst the service receivers in a rapidly expanding communication system in the globalization context. These are other challenges faced by the health sector. Now, it is clear that some of these challenges have to be brought up by the recent developments in economic development. It's a result of the economic development. So health and economic development are really interrelated with each other. Improvements in health have positive as well as negative effects on economic development. And on the other hand, economic development has positive as well as negative effects on health services. Now, I would like to look at the term economic development in a different way. Not just as I said earlier, not just as the improvement of the gross domestic product or per capita income. Dudley Sears, a prominent economist, long time back, he was telling development is a social phenomenon that involves more than growth in per capita output. It involves elimination of poverty, unemployment, and inequity as well. Such an approach brings out the necessity of addressing structural issues, namely education, health, population growth, urbanization, agriculture, industrial reforms, etc., in the efforts of economic development. The World Bank has a similar approach. It says a better quality of life generally calls for high incomes. But it involves much more. It encompasses as ends in themselves better education, higher standards of health and nutrition, less poverty, a clear environment, more equity of opportunities, greater individual freedom, and a richer cultural life as well. So these are the components of economic development according to the World Bank view. Now I would like to get another view that is from Amartya Kumar Sen, the first economist from our region to get the Nobel Prize. He says economic growth cannot be sensibly treated as an end in itself. Development has to be more concerned with enriching the lives we lead and the freedom we enjoy. It's a different approach. It is called the capability approach. He further says, from a policy evaluation point of view, capability approach means looking beyond the means, for instance, income, towards freedoms that allows the individuals to pursue the ends that they value. It's a very philosophical one, but it's going far beyond the increase in the per capita income. The freedom. He's talking about the freedom. He wrote a book with the title of Freedom. Now, with this background, now problem is, what is the way of dealing with the issue mentioned above in a highly socially and economically viable manner? In the broad context, the ability to deal with these issues in a socially and economically viable manner by the health sector alone is highly limited. Simply, however, the role of the sectors such as education, housing and sanitation, in addition to attainment of human rights and, as the World Bank says, richer cultural life. Thus, the role played by the health sectors, health services is essential for economic development, but not sufficient. Or else, better health is essential for economic development, but not sufficient. there is a vast range of many other contributory factors as well. So finally, I would like to say this brings out the necessity of introducing an intersectoral approach to make the role of health services more effective in economic development. Thank you. I think I have not exceeded 15 minutes.
Yeah, excellent, Professor Nimal.